I'm Professor Gavin Giovannoni. I work at Barts in London, in the East End of London in the United Kingdom. I'd just like to highlight certain things that have been presented at ECTRIMS in Paris. I think what we're beginning to see is that the relapsing forms of MS are being well addressed by anti-inflammatory therapies, and there's been a whole lot of new data presented and post-hoc analyses of a whole lot of clinical trials showing how effective these anti-inflammatories are at preventing new and enhancing GAD lesions, and also they're having an impact on end organ damage by preventing progressive brain volume loss. What we haven't yet seen are treatments outside of the relapsing population that actually address more advanced MS or early MS in terms of prevention. However, there's some really exciting hints coming from clinical trials that we've probably been able to modify progressive MS for decades. And the new hypothesis that's been put forward is that MS is a length-dependent axonopathy. In other words, the longest nerve fibers are more susceptible to damage, which is why progressive MS presents in the lower limbs before the upper limbs. And some of the trials have shown a clear distinction between the impact of these therapies on upper limb function, where it's greater, and you see it earlier, compared to lower limb function. The implications of this is that we should probably think about getting rid of the EDSS, the lower limb function, in more advanced disease and clinical trials, not use the EDSS, but really focus on upper limb function and make our primary outcome hand function. In other words, a 9-hole peg test. If we do that, we could also then extend the patient population into people with wheelchairs. In other words, EDSS 7 and 7.5. And if you speak to people with MS, they will tell you hand function is probably more important than lower limb function in terms of preserving independence. So I'm very excited by the possibility of future trials advancing, and including more advanced patients looking at upper limb function. And finally, there have been some data presented showing you that the memory B cell population, a particular subset of B cells, is probably the target of almost all our licensed disease-modifying treatments. And what we now need to see if we can use that biomarker to predict or non-response to treatment. You can always follow us on our blog, where we actually update the community usually on a daily basis about recent events, and that's the Barts MS blog, which is ms-res.org. Thank you very much.